All right. Well, hello, everyone. Happy Friday. And I hope everybody is doing well and appreciate you joining me on this Friday here. All right. So it's been a while since I've done one of these Q&As. And so I am ready to answer questions related to thyroid health, hyperthyroidism and Graves, hypothyroidism and Hashimoto's. Let me go ahead and before answering questions, just for those who are not familiar with some of the resources that besides the Facebook group and the YouTube channel. So I have a podcast called Save My Thyroid, which you could check out by visiting savemythyroid.com. Hard to believe it's been out now for about 3 years. And a little bit more focus on hyperthyroidism just because there's most of the information out there relates to hypothyroidism and Hashimoto. So again, the information I put out, most of it benefits people with both hyper and hypo, both Graves and Hashimoto's, but a little bit more focus on the hyperthyroidism. And also I have a website besides Save My Thyroid. So Save My Thyroid, I released 3 years ago when I created my new podcast, but Natural Endocrine Solutions, that's actually my main website that was released in 2010. So a little over 14 years now. And that has hundreds of articles, blog posts related to thyroid and autoimmune thyroid conditions. Also have a supplement line, which you could check out by visiting thyrosave.com. And then I have 3 books related to thyroid health. First book, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, which was released in 2011, but I just released the 3rd edition in October of 2023. In 2018, I released the book Hashimoto's Triggers, which is a really comprehensive book. I mean, all these books are comprehensive, but that's 500 plus pages. And the Hyperthyroid Healing Diet, my most recent book, released in March of 2024. All right. And then as far as the announcements, so I will be hosting a free event every few months. I try to do a live event. The last one we did was not free. I've done 2 free ones this year. I've done in January, I had one, the accelerated thyroid healing challenge. And in March, the hyperthyroid healing diet challenge to celebrate the release of my new book, The Hyperthyroid Healing Diet. And then I had a paid boot camp in June, the Thyroid Healing Diet boot camp. And so August 19th, I'll be hosting the week of August 19th, a free 5-day Foundations of Overcoming Graves' Disease and Hashimoto's event. And it includes 5 daily live calls. There'll be time for Q&A. If you're in the Facebook group, there'll be engagement with others as well as prizes for participation. And if you want to check it out, visit thyroidfoundations.com, where again, you can register for free. This is the first time I'm releasing this, so hopefully it goes smoothly as far as the registration. If there's any problems, definitely shoot an email, info@naturalendocrinesolutions.com. Just to let you know, once if you register for free, there'll be an option for a VIP upgrade. Sometimes that confuses people when they see the VIP upgrade is not free, but everything you see here is free. Everything with the 5 days. The VIP upgrade is if you want long-term access to recordings and a few other goodies that go along with that. So, all right. If there are questions, now is the time. And while seeing if there are questions and answering questions, I'm just going to leave this announcement slide up this way. If anybody trickles in late, they will see that we're having a live event. And all right, so we have first question is from Ray Dre. So my T3 and T4 and TSH are all within range, but my TIG is climbing. I'm on methimazole, 7.5 milligrams daily. Start out 30 milligrams in December of 2023. What could increase Graves' antibodies under these conditions? Also, I notice my heart rate increases after eating some fruits or sweeter foods. I'm on a paleo diet, so I don't go too crazy with fruit. But is this something you've heard from your patients? I mean, increased heart rate, yeah, sometimes. I mean, it's not uncommon for certain foods, and everybody's different. So I can't say with most of my Graves patients that their heart rate increases after eating sweet foods, including fruit. Uh, Again, just listen. What I commonly tell people is listen to your body. There could be numerous reasons. I mean, there's also some people. Maybe I mean I don't know. In this case, there's problems with histamine. Some people have, but it's usually not limited to fruit. There's like fermented foods and eating other foods higher in histamine can cause elevated heart rate as well. So if it's just the fruit and the sweeter foods, though, that's probably not what we're looking at. But again, like I said, everybody is different, and I would just, I mean, regardless, I would say definitely minimize your consumption of sugar. I recommend that to everybody, even the fruit. Like you said, it's good that you're not going too crazy with the fruit. So even if you're having like one or two servings, you're getting increased heart rate. I mean, I guess it depends on how high it's increasing as far as should you avoid fruit completely at this time. But with the antibodies, so I mean, it's not uncommon at all to have thyroid hormone levels normalize and have elevated antibodies, especially since you're taking the anti-thyroid medication. So you're taking 7.5 milligrams of methimazole. That's definitely going to affect the thyroid numbers. But Graves is an immune system condition more so than a thyroid condition. And so I have a lot of information on my website and podcasts talking about antibodies and different triggers that cause elevated antibodies. I mean, food is one, so it's great that you're following paleo. Some people need to go a little bit stricter and follow autoimmune paleo, but for some people, and I mentioned this, even though I just released the book, The Hyperthyroid Healing Diet, it's not uncommon for people who need to go beyond the diet. And so stress, infections, chemicals are some of the other potential triggers. And I mean, could be mold, which falls into the environmental toxins category. I mean, so you might have to do some detective work. But if you're doing everything from a diet and lifestyle standpoint, and your antibodies aren't decreasing, that's when you definitely want to look elsewhere. Again, in the my book, The Hyperthyroid Healing Diet, of course, most of it is focused on diet, but I have 5 sections in the book, I think. One of the sections is that it goes beyond the diet just because it's not only the diet. A lot of people need to do other things as well. So I made sure to include, even though I could have just said, just get my first book, which I mean, the first book, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, does go deeper into aspects other than the diet. But I really also I wanted to include some information in the Hyperthyroid Healing Diet book as well. So, all right, we have Amy. I'll get to you next. I just want to make sure that it's live streaming to YouTube. I don't know how I could. Let me just check on YouTube and see if I could try to figure that out. Because usually when I do these lives, I get lately they changed the rules. I used to live stream into the Facebook groups, and then Facebook stopped allowing that just because I guess they're private groups, and so now it live streams to my Facebook page and YouTube channel, but I'm not getting any YouTube questions. A few times I've gotten a question, so let me see if I could figure out if it's going to if it's broadcasting on YouTube as well. And if not, we'll just make do. But let's see here. It looks like it's live. Here we go. Let's all right. Okay. I guess just no so far no questions with YouTube. So let me go back to the chat here. And okay, so Amy, Amy says I have both Hashimoto's and Graves' disease. Was on methimazole, titrated off. Now my TSH is falling, still in the normal range. T3 is below normal. Would you consider removal of thyroid as this has happened before? I was put on Synthroid and then into a grave storm, which ultimately led to methimazole. I am on no medication as of now. I mean, you're going to get a biased opinion from me as far as surgery radioactive iodine because my goal is to try to prevent people from receiving it. Again, not to say there's not a time and place for thyroid surgery, but if someone, I don't know what else you did. If all they did was take medication and didn't do anything to address the cause of the problem, then I absolutely don't think again, it's up to you ultimately. But again, if someone's not addressing the cause of the problem and they're just expecting to go into remission, which I know some people do, but it's usually temporary when they go into remission. But if you're not doing things to improve diet and lifestyle and other things to improve your health, again, finding, removing triggers, it's not easy. But I mean, surgery is not easy either. I mean, it's easy to, I guess, go through the surgical procedure, but the recovery from surgery is not easy. There's definitely risks involved. Um, and Amy's did say I have made all the lifestyle changes. So remember what I said to Ray earlier is if someone has, because in her situation she's following paleo diet, maybe she's doing things from a stress management standpoint, but what I told her is if someone's doing everything they can from a diet and lifestyle standpoint and they're not getting the results, then you might need to go beyond that. Now, if you've already done that, if let's say you've worked with one or multiple functional medicine practitioners and you've done a number of different functional medicine testing and looked for other triggers and done things to heal your gut, again, beyond the diet and stress management and sleep. Those are all important. They're pieces of the puzzle. But if you did that, then maybe it is again, I can't say that you should get it, but if someone is going to get it, I would want them to at least have no regrets. And again, maybe you're at that point anyway. I mean, there are people that might do everything from a diet and lifestyle standpoint and just be like, you know what, I don't want to do everything else. Just again, I would make sure if you do get surgery, obviously, make sure you choose a surgeon who has a lot of experience removing thyroid glands. But yeah, again, if someone's made all the lifestyle changes, and again, some might think they made all the lifestyle changes and they might not have, but if you followed an autoimmune protocol for a few months and done everything you can from a stress management perspective, and sleep, and you're still not recovering, and you've also done some functional medicine testing to see if there are other triggers and other underlying imbalances, and did other things besides diet to work on gut healing. Again, there are people who have done that, and if that's the case, I mean, again, there are definitely people that keep on moving forward, trying to address the cause of the problem. But again, I could understand if someone has done all that and then they were in remission, then they got out of remission. And some people, it might happen a few times if they haven't found the trigger and removed the trigger and healed the gut. So I mean, ultimately it's up to it's really your decision, of course. But like I said, I'm gonna give you a biased opinion. If you go to, I would say, most natural healthcare practitioners, but I will say this: a lot of natural healthcare practitioners aren't familiar with Graves. I mean, I've had patients go to naturopaths who told them to get the surgery without really doing any functional medicine testing. Just I think out of fear of the hyperthyroidism. So Yeah. So anyway, it's ultimately your decision. But of course, I work with people that try to prevent them from having to get the surgery, radioactive iodine. But yeah, there is a time and place. And like I said, if you've done everything even beyond diet and lifestyle, then again, it's something to consider. Should you get it? Again, like I said, that's ultimately up to you. If you absolutely feel like you've done everything, you've exhausted everything, maybe one other thing I will say too, and this is on the podcast. So I think it was this year, either this year or last year, I was doing some research on long-term low dose methimazole, which is not ideal, but again, everything is risk versus benefit. So if someone has a choice to be on, let's say, 5 milligrams of methimazole, and if that keeps their numbers in check. Again, not addressing the cause of the problem, but neither is the surgery. It's addressed the surgery is addressing the hyperthyroidism, but if someone has Graves, it's not doing anything for the immune system component. But studies show, and again, I include these studies, the journal articles, and links to the journal articles in the show notes. The studies show that methimazole, assuming someone's tolerating it. I mean, not everybody tolerates methimazole, but if someone's tolerating it, they're not having symptoms, their liver enzymes look good, their white blood cell count looks good. They could take methimazole for 10, 15 years, even longer, which again is not ideal, but if you compare it, some people would say, okay, I'd rather do that than to get surgery. And I think if I was in that situation, I think I would do that. Easy for me to say when I'm not in that situation, as far as needing to rely on methimazole or choose between that or surgery. But I'm pretty sure I would opt for that. But then there's some, because let's put it this way: if you get a complete thyroidectomy, you're gonna have to take this thyroid hormone replacement. So it's not like you won't have to take anything, but yeah, yeah, anyway, just some things to consider. All right, so Corey, I am so confused where to start with healing myself because I have antibodies for both Graves and Hashimoto's. They both keep climbing. My TSH, T3, T4 are all within normal ranges, but reverse T3 is really high. And ferritin is really low. I'm having so many terrible symptoms. I'm thinking maybe hormones are also playing a role because I'm almost 46. I'm on AIP and not getting any relief, help. Yeah. So again, this sounds like another situation. There's a lot of situations where people have to go beyond the diet. If that wasn't the case, then I would have just released the hyperthyroid healing diet years ago and nothing else. But if you read either my book, in your case, Hashimoto's Triggers, for example, there's a lot of different triggers, not just food. Food is one category, maybe it consists of a few chapters in the book, but again, many people need to go deeper than that. Obviously, you got to do things like correct the ferritin, the low ferritin, and look into that. But yeah, I mean, hormone imbalances, other than thyroid, you could have sex hormone imbalances, adrenals, gut health, increased toxic burden. Again, there could be a lot of things going on. So if you haven't already, I definitely would check out the book, Hashimoto's Triggers, which you could find on Amazon. Um, and as well as my podcast episodes and website. And hopefully you also have worked with someone, a functional medicine practitioner. I mean, uh, a reason I released the hyperthyroid healing diet is so people could get the book and do things on their own from a diet and lifestyle standpoint. So obviously you've done AIP, and maybe you've done that on your own. So I think that's perfectly fine. But again, if someone is following AIP, or someone has, let's say they read the hyperthyroid healing diet, again, you have Hashimoto. So, but if someone has done everything again from a diet and lifestyle standpoint, and this is what I've said to the last two people who had questions, again, you probably need to dig deeper. So then, if you haven't already done so, I would highly recommend working with a natural healthcare practitioner. And like I said, if you haven't done so already, also check out the book that I wrote, Hashimoto's Triggers. I think you'll find that to be valuable. All right, so Ling, I have Hashimoto's. My condition is stabilized now. However, after taking ADHD meds, my thyroid symptoms showed up again. So I'm not taking my ADHD meds now. Yeah. So that, again, I can't say I have a lot of Hashimoto's patients on ADHD medication, but that's something I definitely would run by the prescribing doctor. And you mentioned you have thyroid symptoms. I mean, there could definitely be overlap when it comes to different symptoms. And so I would say to, I mean, if you haven't done so already, since taking the ADHD meds and experiencing those symptoms, go ahead and run an updated thyroid panel. And then, again, it's something I would run by your prescribing doctor. Maybe there's alternative. I'm definitely not an expert with the different types of ADHD medications. Maybe there's something else. If you run a thyroid panel, and if you are more on the hypothyroid side, maybe again there is something else you could possibly take. Okay, Amy, you are welcome. Yeah, again, I feel really bad when someone gets thyroid surgery or radioactive iodine. Like I said, I know there's a time and place, and if someone is comfortable with their decision, again, that's again, that's what I want. If someone gets it, to be not have any regrets, and many people who get it are comfortable with their decision. But over the years, I've had so many people that really didn't dig deep enough. Like they came back, and there's some of those people in the Facebook group too, where they got the surgery, they got radioactive iodine, and they regretted their decision. Again, there certainly are people who got the surgery, got radioactive iodine, and are happy with their decision. But yeah, that's like I said, just I want to make sure that it should be usually a last resort. I mean, there's some like if someone has cancer or something like that, that might be a different situation. But all right, we got some YouTube questions. So from Christina. Hi, Dr. Eric. Thanks so much for the video. I've been recently diagnosed with Graves, and these are my numbers. So T4, 25.86. I'm thinking you might be not in the United States because most labs won't go that high for free T4. And usually we don't see total T4 that high. TRAB, um, TSH receptor antibodies 6.62, TSH 0.0037, TPO antibodies 1270, thyroglobulin antibodies 658.70. How severe is this? Um, I mean, again, the reference range for again, this I assume you're not. I don't know if you have any follow-ups here, but as far as where you're from, but I think this is again, I think you're from outside of the United States. So I know some of the ranges go up to like 20. And if that's the case, that would 25.86 wouldn't be too bad. Would be great to see the T3 as well. I mean, TPO antibodies are pretty high. Thyroglobulin antibodies are pretty high. Um, which is not uncommon with having the high because those are Hashimoto's antibodies, especially the thyroglobulin antibodies. So you have antibodies for both Graves and Hashimoto's. The TRAB, not too bad. Typically, the range is less than 1.75. TSI looks like it wasn't tested, which isn't so. So I would say, I mean, the Hashimoto's antibodies are pretty high. The Graves' disease antibodies, not too bad. Again, though, the how high the antibodies, at least with Hashimoto's, doesn't always relate to the severity. With Graves, many times it does. The higher the Graves antibodies, a more vigorous immune response typically. But so I would say, at least from a Graves standpoint and hyperthyroid standpoint, not too bad. I mean, it's not on like if we talk about mild, moderate, severe, maybe moderate, not definitely not severe. Hashimoto's antibodies definitely high, but again, it doesn't mean that you have a more severe case of Hashimoto's. It's really hard to say with the antibodies. All right, I will be right back. I hold on just a sec. Okay, I am back. I'm working from my home office and heard some background noise with that we have cats and dogs. Dogs are all locked up, but had anyway. So just checking on the kitties. Usually they're pretty quiet but again, unpredictable. So just checking, making sure everything's okay. So um, all right, so let's. Okay, this is Christina also says, okay, I've been prescribed 5 milligrams of methimazole, but I'm so afraid to take the meds. And I'm also very scared of getting TED if I don't take the meds. I mean, taking the methimazole isn't necessarily going to prevent thyroid eye disease from occurring. So, yeah, I mean, that's more related to the autoimmune response than the thyroid hormones. And again, the TSH receptor antibodies aren't really high. So, I mean, that doesn't mean you can't develop thyroid eye disease, but not as big of a risk of developing thyroid eye disease. So, yeah, I mean, and uh, just keep this in mind. I'm not telling you, I mean, it's up to you whether or not you want to take the methimazole. I mean, there's bugleweed. Like when I dealt with Graves, I took bugleweed. I chose not to take methimazole, but you want to do something. You want to do something to lower the thyroid hormone levels because elevations in thyroid hormones not only can affect the heart rate, but it could also affect the bone density, which isn't a good thing. So I would either look into natural agents such as bugleweed or higher doses of L-carnitine, and or look into taking the methimazole. I mean, 5 milligrams is definitely a low dose. Some people don't do well with a low dose. I mean, a lot of people don't want to take methimazole because they read the side effects about the side effects. But again, not everybody has problems with methimazole. So again, risk versus benefits. And yeah, definitely also I'll now that we're almost like a half hour into this, for anybody who trickled in, you might see in the background, I'm having a free 5-day Foundations of Overcoming Graves' Disease and Hashimoto's live events starting a week from this Monday. So Monday, August 19th. So definitely check that out. Thyroidfoundations.com is where you could register. Yeah. So anyway, hope to see some of you there. All right, someone else on YouTube. Okay, so definitely we got some YouTube questions. I was concerned because first we were just getting Facebook questions, but so my T4s are my T4 are 0, my T3s are at 5.9, taking 17.5 milligrams per day. Was taking T4 medication, increased my T4s. Okay, so my T4s, so your T4, that's the free T4 0, your T3 at 5.9, taking 17.5 milligrams. I assume a methimazole per day. But then said you were taking T4 medication, maybe doing like block and replace therapy. And so it increased your T4 to 6.7. So you stopped. You stopped taking a T4. Not sure what to do given my T3s are still high and 0 T4. Yeah, that is interesting. So your T4, that is weird that it's suppressing I mean, it's also weird that your T4 is 0. I mean, that's usually not going to be like completely 0. That's weird. I mean, unusual, I'll say. So, and then if this is free T3, like I don't know if you're in the United States, but the range, United States, this is usually like the optimal range, like 3 to 3.5. So 5.9, not crazy, crazy high, but definitely high. But it's so if you're taking 17.5 milligrams of methimazole and it's suppressing T4, but not suppressing T3, like I said, or maybe it is, but it's just still high. Um, and then you're taking T4 medication. So, I mean, still block and replace therapy might be an option, maybe not taking as much T4. Uh, so that's an option to consider. I mean, the other thing, I'm not a big fan of beta blockers, but certain beta well, actually, there's also PTU. So PTU, I was gonna say beta blockers like propranolol affect conversion of T4 to T3. It can inhibit that, but I believe PTU does that as well. Again, some people are scared of PTU because they read about it causing liver failure and all that. And I do have a podcast episode on that, but that might be an option too, to maybe speak with your prescribing practitioner about switching to PTU. So those are the main things. I mean, obviously, still do things to address the cause of the problem. So hopefully long term you don't have to rely on the medication, but in the meantime, yeah, you might want to look into taking a lower dose of the T4, or taking something that also inhibits that T4 to T3 conversion, whether it's something like propranolol, or again switching from methimazole to PTU. And Cheryl with a follow up. I've been having this issue for the last few months. Yeah. Okay. So yeah. Yeah. So I guess it's tapazole, which pretty much methimazole. Okay. I'm on a gluten-free diet for more than a month, and I've also excluded sugar, dairy, caffeine. I don't smoke. Wonder if this will have an impact on the TRAB. Yeah. Gluten-free diet could. I mean, again, like I said, diet definitely could, but many times people have to go beyond the diet. Okay, I'm gonna try to get to everybody at least once. I'll be on until 2:30 my time, so another like 27 minutes or so, 27, 28 minutes. Um, and if I don't answer your question, or if I miss, again, I'll try to get to everybody at least once, but if there are unanswered questions, you could attend the live event that's taking place, and I'll definitely be answering questions then. All right. So, Jessica, what are some basic triggers? So, we got food such as gluten, dairy, corn. We got stress, physical stress, emotional stress, uh, chemicals such as heavy metals like mercury, and uh, xenoestrogen such as bisphenol A. And we got infections such as Epstein-Barr, H. pylori, uh, parasites, for example, Lyme disease, molds also would be a trigger falling under environmental toxins. So and I don't know if you would call that a basic trigger, but if you want to really get basic, food, stress, chemicals, infections. Some say nutrient deficiencies, which I consider more of an underlying imbalance. Okay, Linda, you are welcome. All right, let's make sure that I'm not missing anybody. So Mrs. Doc says, "Hi, doctor," and TSH 0.01, T4 3.7. So it looks like you're on the hyper side. So just found this out and hoping for guidance. I mean, pretty much you would want to address the cause of the problem, and in the meantime do things to lower the thyroid hormones. I mean, the medical doctors are going to recommend anti-thyroid medication, and then there are other alternatives like bugleweed and L-carnitine. Definitely visit my podcast, savemythyroid.com. And also, if you just found this out, register for the free. In the background, you see the PowerPoint, the 5-day foundations of overcoming Graves' disease and Hashimoto's. I don't know if you have Graves, but even if you have non-autoimmune hyperthyroidism, you'll benefit from a lot of the information. So visit thyroidfoundations.com. Again, completely free. There is an upgrade option, but again, that's completely optional. Okay, Courtney, I don't think I've answered your this a question from you. So is alcohol something to stay away with from Graves, hyperthyroid, and if so, why? I mean, usually you do want to avoid it just because alcohol can affect the permeability of the gut. So it can cause or contribute to a leaky gut, which is a factor in autoimmune thyroid conditions such as Graves. So with Graves and Hashimoto's, we're trying to heal the gut. So if you're drinking alcohol, I mean, if you're taking like an herbal extract with a little bit of alcohol, not usually not a concern, but if you're drinking alcohol, then it can increase permeability and make it more challenging to heal the gut. So, yeah, I would definitely recommend to avoid alcohol while healing. Okay, Mrs. Doc said they are checking for graves. Okay. All right, let's see. I think I've answered everybody at least once, like one question from everybody. Let me take a quick sip of water here. So, Corey, I'm frustrated because I was in remission for 8 years. Which functional medicine testing do you think is the most beneficial? Because it is very expensive and all out of pocket. Yeah, I realize. I understand that. I mean, I understand it's frustrating after being in remission for 8 years. Um, but I mean, and if you haven't done anything to address the cause of the problem, that's actually great because most people don't stay in remission that long by just taking the methimazole. I mean, some people do, but eventually they do relapse. So, I mean, again, I would do everything you can from a diet and lifestyle standpoint. And then, I mean, far as like basic testing, like adrenal saliva testing, blood comprehensive, I do recommend comprehensive blood testing, like not just thyroid panel, but vitamin D and iron panel and B12. And I like to look at blood sugar markers, look at homocysteine and CRP. And again, I talk about all these. I have episodes on my podcast on this. Or if you don't want to skip around, you could just look in my books. Like my books also more organized and jumping around with the podcast. But adrenal saliva testing or dried urine testing, a lot of it depends on the health history. So, but most of my patients will get comprehensive blood testing, some type of adrenal test. Some people will get a comprehensive stool test to look at the state of the health. I mean the health of the gut, the state of the gut. So again, those are some things I would start. I mean, I do tend to be conservative with the testing. I mean, you could, some might not think that, but you go to some practitioners, I'll recommend for everybody 5 tests that could cost a few $1,000s. And I've had some of those people on my podcast. And not to say there's anything wrong with that. That's just their approach. But yeah, those are some of the tests I would say um, to maybe consider starting out with. Uh, Again, adrenal saliva test. I also like hair testing, which is a little bit controversial in the functional medicine world, but so I typically recommend some type of adrenal testing, hair testing, comprehensive blood testing, sometimes stool testing, sometimes organic acids testing. Um, all right, so Ray Dre, what are your thoughts on non-alcoholic drinks that contain adaptives or CBD or THC? Um, I I mean, I'm not against CBD or THC, so I don't know about like drink like beverages that have CBD or THC, but uh, as far as CBD, THC, just without talking about them in beverages, I think they could be beneficial. They could help to reduce inflammation. I mean, a lot of people take the CBD without the THC, but again, both of those have inflammatory properties. Could also help some people with sleep. So yeah, I can't say I'm against those. It's not something I recommend to most patients, but there is a time and place for that. All right. Ling asked, "Does your book have an e-version that could be read on Kindle?" Yeah, all three of my books are on Kindle, and then both hyperthyroid books. So the third edition of Natural Treatment Solutions for Hyperthyroidism and Graves, and then the Hyperthyroid Healing Diet. Uh, I just recorded audiobooks in 2023, 2024. Hashimoto's Triggers doesn't. And probably won't because I eventually might update it. So I really don't want to take the time because it is very time consuming to record an audiobook, and Hashimoto's Triggers is very, very long. Like I said, over 500 pages. So I really don't want to take a few months to record that. And then, I mean, I'm not updating the book next year, but it might be a couple of years down, which might sound long, but again, that's not an audiobook, but all my books are in you could get in Kindle format or paperback. And then again, the two hyperthyroid books you could get um, in as an audiobook. Okay, Christina, not from the US. Yeah, I guess because of your numbers. Yeah, because your T4 25.86. So yeah, so that's what I figured. Okay, and Corey Joe. So I've read a ton, but the reason I'm unsure what to take is because of having both Hashimoto's and Graves. For instance, if you have Graves, you should avoid iodine, but with Hashimoto's, you need iodine. Not necessarily true. I mean, a lot of practitioners are. I mean, I would be cautious with iodine. I mean, some think that you might need iodine in Hashimoto's because you have low thyroid. Like with Hashimoto's, you more likely to have low thyroid hormone, and iodine is important for thyroid hormone formation. But the reason why someone has Hashimoto's is not because they're iodine deficient; it's because of the immune system attacking the thyroid gland that leads to the lower thyroid hormone in the first place. So, iodine very controversial with both Graves and Hashimoto's. Um, and then your endocrinologist wants me taking motherwort, bugleweed, and lemon balm. Wow. I very rarely do I see endocrinologist recommends the herbs. Yeah, I need to meet your endocrinologist, but um, yeah, with my TSH, T3, and T4 in range, but reverse T3 very high. Does that sound right? Why? Why not? Um, well, I mean, motherwort is more based on the symptoms. So if you're having cardiac symptoms like palpitations, I would say then maybe you could benefit from it. But if not, then you probably don't need it. The bugleweed is more based on the thyroid hormone. So if TSH, T3, and T4 are in range, but reverse T3 very high, then I usually would not recommend bugleweed for that purpose. So yeah, I usually wouldn't like recommend like if I would recommend if someone's hyper, elevated T3, T4, depressed TSH would be an indication for bugleweed. Lemon balm again, more for like its calming effects, and motherwort more for the symptoms, like cardiac symptoms. So yeah, like I'm very happy that the endocrinologist is open to giving the herbs, but it's yeah, I'm not sure why why he or she is recommending those herbs with the thyroid panel normal, unless if maybe they're on the higher side of range, but usually if the T3 and T4 are higher side of range, TSH will be low, but if TSH is normal, yeah. So anyway, that's yeah, I'm not sure. But I would say that I mean if someone has antibodies for both Graves and Hashimoto's, I mean, both autoimmune, so you want to find, remove triggers, heal the gut. So that really doesn't change. But symptom management wise, if someone has hyperthyroidism, if they have Graves and Hashimoto's antibodies, but they're hyper, then that's when I would recommend things like bugleweed motherwort. If someone has those antibodies and they're usually more hypo, then I mean maybe they need thyroid hormone replacement. I mean, if they have the antibodies but their thyroid's normal, maybe they don't need anything from a symptomatic standpoint. So again, everybody is different, and we have Ling here. Is the bulging eye condition related to the antibody levels? Yes. So typically the higher this isn't the case with everybody, but with most people, the higher the thyroid antibodies, the more likely someone is to have thyroid eye disease. So yeah, the severity of the thyroid antibodies in Graves usually makes someone more likely to have thyroid eye disease, including bulging eyes. So I had bulging eyes for more than 10 years, but after the diet change, the eye swelling has decreased and I no longer have a bulging eye or puffy face. Wow, that's great. Thank you so much for sharing. Very happy that that is the case. So Jessica asked, how do I take thyroid calming if I take beta blockers and methimazole? I eventually want to go natural. I mean, if someone's taking the medication and if they want to add something like thyroid calming formula, which is from Herb Farm, What I usually would recommend is to take it away from the meds, usually like maybe like 45 minutes away from the meds, and then just monitor the thyroid. I mean, what if someone, and again, thyroid calming formula is good quality, but it's not high potency. Usually, my approach would usually be if someone wants to rely more on the natural agents and not the medication. Now, again, I'm not going to tell them to stop the medication or reduce the dose of medication, but rather than putting them on something like thyroid calming, which a lot of people take because it has the bugleweed, the motherwort, and the lemon balm, I would just put them on the bugleweed because that's the main herb that lowers the thyroid hormone levels. And then if someone's on the bugleweed and methimazole, and then you're also taking a beta blocker, but the hope is that they'll eventually their numbers will become hypo, their thyroid panel will become hypo, and then the prescribing doctor should reduce the dose of the methimazole, and then the person will be relying more on the bugleweed. But the problem with thyroid calming formula is that it has all three, so it doesn't have, which again could be a good thing sometimes, but if we're trying to lower thyroid hormone levels, it might not have enough bugleweed in some cases. It depends on the person. So usually I'll just recommend bugleweed separately. All right. So Courtney says or asks, how do I know how much L-carnitine to take? My pills are 1,000 milligrams. So the research shows that you want those with hyperthyroidism would need to take between 2,000 to 4,000 milligrams per day in divided doses. So, for example, like 1,000 milligrams twice per day, and that to help block the entry of thyroid hormone into the cell. So that is the dose according to the literature. Okay, Ling, is artificial sweeteners not good for the thyroid? I drank 6 to 7 bags of lemon tea with artificial sweeteners. I mean, I don't know if the sweeteners, artificial sweeteners, directly impact thyroid. I haven't seen anything on that, but there is evidence that they could disrupt the gut microbiome, which is never a good thing. And especially if someone has Graves or Hashimoto's, which are autoimmune conditions, and most of the immune system cells are in the gut. So yeah, I definitely recommend for my patients to avoid artificial sweeteners. Yeah, just mainly because the concerns that it might disrupt the gut microbiome. Okay, so Cheryl is in Canada. I know you gave some. Um, let's see, you gave some numbers. So yeah, I don't know if the range is. I mean, I have a person currently, like from again, not uncommon. Work with people from all over the world, but commonly have people in Canada and the and Europe, more so than some other areas of the country. But do you ever? Okay, this is a question for. Do you ever cheat while eating? I mean, keep in mind I've been in remission since 2009, so I'm not following like AIP diet, and I'm most of the time I'm paleo, but I'm definitely not 100%. So yeah, the answer is yes, I do cheat sometimes. Um, and I tell that I say that without any hesitation because when I don't want people to think that they can never cheat, that they can never eat a bad food, food that they again, there's things that while I was healing, I was pretty strict with the diet. But since 2009, so again, we're talking about 15 years, I'd be lying if I told you that, I've never been exposed to gluten or dairy or, other foods. It's just not, it's not, especially things like gluten. It's not right. It's definitely not frequent. But dairy, again, when I have a cauliflower crust pizza, I don't have the vegan cheese. I have the real cheese. And again, it's not like I only have that like once or twice a year. I don't have it like a few times a month, but yeah. So I definitely do stray from the diet. But I am pretty good about not straying for like not completely falling off the wagon for like weeks or months. So even if I'm on vacation and if I stray from the diet, I'll still most of the time eat pretty good. But yeah, I might stray, and then when I get back home, I'm back on track. Where some people they've wrecked their diet completely while away, and then they're like, I've already wrecked it, so I'm just going to continue eating like crap. Where it should be the opposite. Okay, I've wrecked my diet, but I'm going to get on track. And some people definitely do that, but other people, they're in the habit of eating junk, and they stay in the habit of eating junk. And yeah, so I'm pretty good about being disciplined and not straying for too long. Are you accepting new patients? I'm in Illinois. Could it be via telehealth? What's the best way to become a patient? Yeah, if you're still on the Courtney, um, let me I mean, you can reach out to Kate, my staff person, Kate. She's not in the office today. She'll be back on Monday, but her email is staff@naturalendocrinesolutions.com. But if you or anyone else is interested, you could visit workwithdreric.com. I require everyone to watch a recorded webinar just to get an idea of what it's like to work with me. And it also talks about things that people are interested in, like the fees and things like that. So towards the end of the webinar. So, but yeah, check out workwithdreric.com. Let's see. Let me get back to. Um, all right. Actually, AJ, I haven't answered a question from you yet. So let's see. So, what is the most effective dose of standard processed bugleweed? The bottle starts at 1 teaspoon dose. I mean, it depends on the person. I mean, I took 1 teaspoon twice per day when I dealt with Graves. If someone has severe thyroid hormone levels, I'll recommend sometimes 1 teaspoon 3 times a day. But if someone's thyroid hormones are on the mild side, I might have them do like half a teaspoon a couple of times a day. So yeah, it does vary. But I mean, and that's the bad thing about the bugleweed. I mean, the good and bad thing. I mean, you definitely eh, depending on the person. Like when I took bugleweed, I knew it was working because my heart rate was decreasing and I was still having heart palpitations. And then I added the motherwort, also from MediHerb, which is distributed through standard process. But really, you don't know for sure until you retest the thyroid hormones. That's the only bad thing about it. So so if the numbers, it really depends on what the numbers look like. If they are like moderate to severe, I'll definitely have people take a teaspoon multiple times per day, and then we'll see what the next blood test looks like, and then make any modifications. All right, so I'm gonna go like another like 6 minutes or so. Again, remember if you don't, I mean, I've answered most questions, but if there are other questions, I mean, everybody has like there are always questions. So thyroidfoundations.com where you could register for the free events I'll be having a week from Monday. So Link says, I love beverages and chips, but I try to avoid all gluten containing food. Don't know if that's good enough. I mean, it's great, but I mean, it depends on the person. A lot of people need to go do more than just avoid gluten. Some people avoid gluten and dairy, and again, not for some people I mean, that's great regardless. I mean, I used to eat just like a lot of people I'm sure here. Like if you go back, I'm 53, I'll be turning 54 in October, and I mean, you go back, I mean, definitely when I was younger, when I like 30 years ago, 40 years ago. Yeah, 40 years ago, I was a teenager. And yeah, I mean, definitely eating my fair share of gluten. And even after chiropractic school, it's not like I cut out the gluten after graduated from chiropractic and was really once I dealt with Graves, that's when I was really, when I made the changes. But again, I mean, I can't say I love beverages. I mean, I used to drink a lot of soda and other things. But I mean, I'm pretty good with water, but I love chips. So sometimes I'll get the avocado, the chips in avocado oil, or the sweet potato chips with coconut oil. But again, while healing, I would just be cautious. Sweet potato chips with coconut oil are actually AIP compliant, but you still want to be careful. You don't want to eat like half a bag per day. Okay, Corey, you are welcome. And Jessica, you're welcome. Bling, you're welcome. Okay, and Courtney, okay, he's still here, and you're welcome, and thank you. Um, yeah, and if you also, I'm blanking out with the number. Like if you visit naturalenergiesolutions.com, you could also call the office. So you could might want to email Kate just because when she gets in on Monday, she get usually has a bunch of emails from like the because again she's off on Thursday. I mean off on Friday, so then she gets in at like 10 a.m. Actually, she doesn't get in anymore. We have a physical office, and I'm in Matthews, North Carolina. But Kate Kate recently moved, so she used to work out of the office as of a few months ago, but now she's working from home, but still she still sticks with her hours, which again, I understand. I would too. So again, you might want to shoot her an email, but she definitely can chat with you if you wanted to speak with her over the phone, or through Zoom. Okay, Mrs. Doc, what would mild thyroid numbers be? I want to try bugleweed as well. I mean, again, this is based on United States numbers, so like if someone had, let's say, a free T4 of like 2.1 and a free T3 of like 5.2, like that's an example of mild. If someone had I mean, the LabCorp and Quest Diagnostics, like free T4 goes up to 7.77. I don't know why they use that number, but I believe both of them do. So if someone's like greater than 7.77, and then free T3 goes up to 20, so if they're like greater than 20, that's definitely severe. Now, if they're a little bit below that, I would still say on the higher side, and then like in the middle of those ranges would be kind of moderate. All right. So laying my lower leg swells up from time to time. Is it possible that my thyroid conditions could be causing this? I mean, it is possible. I mean, thyroid controls every cell, tissue in the body. So it is possible. Um, I mean, obviously, you want either way, you want to balance the thyroid hormones. But liver and lymphatics, there's a really good episode on the podcast that I don't know the number, but if you do a search, if you visit savemythyroid.com and click on podcast, and there's a search bar, and Kelly Kennedy, I interviewed her last year, really good interview on lymphatics. So supporting lymphatics can help with some cases of swelling, depending on what the cause of the problem is. So, Courtney, what is the optimal range in the USA for free T3, free T4, TSH? So, free T4, I would say between 1 and 1.5, free T3 between 3 and 3.5, TSH, some will say between 1 and 2. I would say, I mean, if someone's like 1.8 TSH and the other numbers look good, I'll be fine with that. But I'd say 1 to 1.5 for the TSH is even better. So, those would be my not just my optimal ranges. Again, I learned a lot from attending blood chemistry courses, as taking not only just continuing education credits, but usually when I take these courses, I take things that I enjoy, uh, the functional medicine courses, but I've taken numerous blood chemistry courses, and usually most agree with the ranges. I mean, they might not, if you get 10 functional medicine practitioners, they might not agree exactly, but they'll be pretty close as far as the United States ranges. So, all right. Well, wonderful. Well, all right. Well, we made it an hour, and thank you so much for attending. So, again, for a week from this Monday, August 19th, I have a free 5-day event. This is the first time I'm announcing it. So again, if hopefully there's no glitches. I did test it out, but you should, when you register, it should take you to a VIP upgrade page, which again is completely optional. There's a $37 VIP upgrade to get the recordings, but even if you don't get that, you'll get recordings until the August 28th. You'll have access to the recordings, and of course, you can attend the live calls. You can ask questions there as well. So definitely recommend doing that. And yeah, and that's. Hold on, we got one other question from Courtney here. I believe my trigger was is stress Stress is pretty normal for my life, sadly. Any recommendations on how to manage this? Do you recommend anxiety meds? I mean, it's a common trigger for most people with thyroid, autoimmune thyroid conditions. When I dealt with Graves, it definitely was one of the triggers as well. And most people, like, I didn't take anxiety meds. Most of my patients don't. I'm not saying there's not a time and place, but I mean, just blocking out time on a regular basis for stress management could help a great deal. And it's something I definitely recommend for really everybody to do to get into the routine of stress handling. 5 minutes per day of some type of mind body medicine is what I typically would recommend, and then gradually increase. And again, there are definitely episodes on the podcast where I talk more about this, or naturalendocrinesolutions.com. But just like getting into the routine when it comes to exercise, same thing with stress management. You need to train your body to adapt to the stressors, because you're not going to get rid of the stressors. So really the only thing you can do is to adapt, and it does take time for that to happen. All right, and Mrs. Doc, you are welcome as well. All right. Well, again, thank you so much for taking time on your Friday to tune in to Facebook and YouTube and to ask questions. I'm glad I got to, I think, all of them, so at least most of them, but I think I answer all questions. So again, everyone, have a great rest of your Friday. A great weekend ahead. Courtney, you are welcome. Thank you for your questions. And Ling, thank you. And Jane says, thank you so much for your time. See you on the 19th. Yep, I'll be live Monday through Friday. Again, I'm going to be rotating times to accommodate those in different time zones. So some days I'll be live at 12 noon Eastern time, other times 8:30 p.m. Eastern time. So regardless of where you are, definitely tune in. And again, if you can't attend live, just you'll watch a recording. So I still would register even if you can't attend the live calls. AJ, thank you. Thanks for your question. Again, everyone, take care. And again, have a great Friday and a great weekend ahead.